Let's now turn to our health headlines today. Ketamine nasal sprays offer a new option for people with treatment-resistant depression, plus how so-called magic mushrooms could help with a range of mental health conditions, plus training the doctors who will deliver these treatments in the future. Joining us to tell us more is Dr. Benjamin Kelmendi, co-director of the newly established Yale Program for Psychedelic Science. Nice to be with you, Doctor. Good morning.
Good morning. Thank you for having me.
Of course. I have to be honest. I think when people hear magic mushrooms and they hear ketamine, it's really difficult to sort of understand how this could be controlled and how this could help people. But ketamine infusions, they have been effective at treating depression in some patients who don't respond to antidepressants. What can you tell us about this?
Absolutely. For individuals with depression who haven't found relief from standard of care treatments, psychotherapy, and medications, ketamine truly represents a significant breakthrough. Traditional treatments typically take weeks to work, while ketamine often works within hours or days. The nasal spray you talk about, also called as ketamine, appears to be more convenient than IV infusions. But to note, nasal spray is also administered in a medical setting where patients typically are closely monitored during and after each session for safety. Here at Yale, we're actually launching a study to compare how well the nasal spray ketamine compared to IV ketamine. Most patients typically seem to need several sessions rather than just one treatment. But this approach is providing new options for people who haven't had success with other medications. And for many patients, the difference has been truly transformative.
Very interesting. You are also investigating and researching the active ingredient in what we know as psychedelic mushrooms. Tell us more about that specific ingredient, what it is, and I guess how this is also helping with depression and mental health conditions.
Absolutely, you're correct. Psilocybin is the active compound in psychedelic mushrooms and has been shown promising results across multiple mental health conditions, including PTSD, depression, as well as OCD. And here at Yale, I'm leading the first controlled clinical trial of psilocybin for OCD, and early results have been quite actually encouraging. What's different about psilocybin is that it's not a daily pill. It involves guided therapy where patients appear to experience break free from patterns of thinking and behaviors that have kept them symptomatic. And some participants seem to experience relief that lasts from months after just one or two carefully supervised treatment sessions.
Very interesting. And quickly, as we wrap up here, Doctor, I do want to get this info out because I think it's really opening, I guess, the door for the next generation of medicine. I find this interesting that you guys at Yale, you're working with Johns Hopkins and NYU to now create fellowships in psychedelic psychiatry. What do you think this means for the next generation of doctors?
Absolutely. As the research progresses in psychedelic medicine, we recognize the importance of preparing qualified providers who can deliver these treatments when they become available. And that is why Yale partnered with Johns Hopkins and NYU to establish the first formal fellowship in psychedelic psychiatry, because these treatments require specialized expertise in patient preparation, guided therapeutic session, and post-treatment integration. So we are developing a curriculum that actually meets national medical accreditation standards to ensure that providers can deliver these therapies safely and effectively. We're essentially establishing a new psychiatric subspecialty, something that is similar to addiction medicine. So when these treatments are approved, patients will have access to clinicians who understand both the therapeutic potential and clinical responsibilities these treatments demand.
Very interesting. Well, thank you for sharing all of this with us, and thank you for your time.
Absolutely. Thank you so much.